Dr. Kylie Burton, thank you so much for coming on the Life on Purpose podcast. We have been trying to connect for the last couple of months now, so I'm really excited that you're finally here and we can um, talk all things kind of functional medicine and women's health. So you have kind of this unique talent of getting to the bottom of quote unquote normal labs where people are feeling like complete crap still, right?
Yeah. Yeah. They've been told their labs are normal, yet they're like,
I
why do I feel
feel
like this?
like,
And
right.
they're just
So
tossed from doctor to doctor. So it's a journey.
yeah, so I'm grateful you're here. So what I want you to do, I would love for you to just kind of tell us all a little bit about yourself, and what it is you do.
So I'm Dr. Kylie Burton. I'm a functional medicine specialist and I have a background in chiropractic, but I'm one of those crazy chiros who doesn't even own a chiropractic table. All of my love and my life and the reason why I did what I did is because of functional medicine. But ultimately, I grew up in an alternate or in a Western medicine world. When you got sick, you went and got antibiotics. That was just how we lived. And that's fine and totally worked for us. But I got introduced to this world of functional medicine. And the funny thing was, is I got my bachelor's degree in nutrition. And, I'm thinking, I'm going to teach people how to read the food plate and the food pyramid and the RDA values, and they're going to get healthy based off of their food. Well, you get into functional medicine and all of that goes out the window. It's taking food to a whole new level. So I got started with that, introduced to that. And I was an assistant for a chiropractor, a male chiropractor. And he always had these females coming in. And nothing to him, that wasn't the problem. It was the fact that it was a male versus a female.
Mm-hmm.
And so I would see these women coming in first and I would get them prepped and ready for him to come in. And they would tell me all these libido issues and hormone issues and fatigue issues and menstruation issues and menopause issues. And then they would say, but don't tell the doctor. Okay, well, even though the doctor can help you, it's not my job to tell him, it's yours.
Yeah.
So finally, I was just like, you know what? If these women aren't getting the help that they are searching for, why don't I just become the doctor? I have
Yeah.
everything I need. I can go to doctorate school and get my license and be that person for them. So I did. So I went off to Portland, Oregon, where I became a chiropractic student. But one of the things that people don't understand about chiropractic school, especially the one in Oregon, is that it's medical school
Mm-hmm.
jammed into 4 years. So we ultimately took, 35 credits a quarter. It was basically you survive or you don't. And I also don't think that people understand. I performed gynecology exams. I performed urinary exams. I performed genitourinary exams. And in Oregon, you can become a midwife. You can become a surgeon. You can do all of these things underneath a chiropractic license. So
Mm-hmm.
we had to learn them all.
Right.
So our schooling was very intensive. In fact, the week before I got married, I took 22 exams. I
Oh my
finished Sunday
God.
night. I flew back to Utah Monday. I was married on Tuesday, and then we flew back to Oregon Saturday. So it was like all within a 2 week time period, took 22 exams, and then I went and got married.
I was gonna say, do you remember any of that?
I remember it's like the weirdest emotional roller coaster ever
Yeah.
because we got through the first half of the week and my soon to be husband and I were sitting in our apartment in Oregon and he was like, "Well, how many more lab tests do you have?" And I said, "Honey, it doesn't matter how many more. The one that matters is the next one.
Yeah.
You
It was
just
just
had to
getting through
take it
one at a time.
Yeah, you just had to take it one at a time. And yeah, I'd already done 9 exams in the last 2 days, and I still had that many more plus more to go.
Mm-hmm.
But it didn't matter how many, it was always just focus on the next one, then get that one through, then focus on the next one. And so it was like the most stressful time because you're under so much pressure that you don't eat, but you have to eat because your brain requires food for energy to work. So you're just forcing food in your mouth, and usually it's not you're wanting like ice cream and
It's all the bad
sugar.
stuff you're learning. That's probably not the best for brain health and all
Yeah,
of
for
that. Uh-oh, hold on. We've got some sort of glitch here. Can you hear me okay? Mm-mm.
What about now?
Oh, there we go.
And I need to get an updated system.
Okay, there. Perfect. Well, I can hear you. I can hear you just fine. So,
Unplug the speaker.
so basically this kind of program and this kind of route is just as intense as the traditional MD route, and you understand the human body in a completely the same way, but also in a completely different way as a whole, right? As the system's not separated, but the systems as a whole.
Yes. Yeah. And one of the big things is we weren't taught, especially with my functional medicine background, was when you think about a diagnosis, think about it. A diagnosis is something where your symptoms fit underneath an umbrella.
Mm-hmm.
And if you don't have symptoms that fit underneath an umbrella, they don't know what to do with you. But as soon as they can give you a diagnosis, then there's a pill to manage your symptoms that go with it.
Right. So it's like matching your symptom to a pharmaceutical and then washing your hands of it.
Yes.
Yeah.
Yeah, and saying, okay, you're going to take Humira for the rest of your life to manage your RA.
Mm-hmm.
You're going to take steroids for the rest of your life to manage your flares of autoimmune disease.
Yeah.
Lyrica for fibromyalgia. All of these things where my approach is, you might have RA. What caused it?
Right.
What triggered your body to start attacking your joints?
And that's always been my biggest thing. We have some chronic disease issues in my family. I myself deal with autoimmune thyroid disease, both Graves' disease and Hashimoto's. My mom has lupus and Hashimoto's. There's this kind of chronic issue. And my biggest question has always been why? And nobody could ever tell me why. And it drove me crazy. And it didn't bother them at all. It didn't bother them at all. So that's how I ended up in functional medicine, because I was so intent on figuring out why. And I felt like nobody was asking that question.
Well, the difficult problem is it's not the doctor's fault.
Correct.
I mean, it's the toolkit that they were given in medical school is very limited.
Yeah.
And if it doesn't fit underneath that umbrella, they really don't know what to do. So yeah, you can get Hashimoto's. It's the same thing as like Epstein-Barr virus. You get positive tests for Epstein-Barr virus, they tell you, well, go home and sleep for 3 months. Good luck.
Yeah.
Like their toolkit is just so limited. Whereas I'm saying you might have an Epstein-Barr virus test, but let's do an antiviral and support the immune system, things like that. We can do things like that to eliminate that viral component. But yes, the big question to why is functional medicine when it's done right.
Right.
And a lot of times it's done wrong in the fact that a lot of people will just eliminate foods.
Mm-hmm.
That's a great place to start, but I like food.
Yeah.
And I don't want to be gluten-free, dairy-free, soy-free, sugar-free, peanut butter-free, egg-free. I mean, you name all these, quote, inflammatory foods that people are getting rid of out of their diet. What are they eating? Like 5, 6, 7 items a day, every single day of the week, all day long, every day. And that's a problem too. So when you look at the why behind things, that's one of the reasons why I love the labs. And I first got into the lab component of it when I was at chiropractic school, and I was just finishing up. A lady from the community had come in, and I had this 25-page intake form. I wasn't supposed to be using it, apparently. You're only supposed to use their like little half-page little dinky thing that you're not going to get any information from, but
yeah.
That's what we're supposed to. So I had this 25-page intake form, which I used to use in practice. I've never had anybody complain about it, because it's like by the time they get to me, they're like, finally, somebody wants to know how I feel and put all my puzzle pieces together. So this lady had my intake form. And unfortunately, it got in the hands of the head clinical director, and I got suspended because of it.
Oh no.
So I literally got suspended in medical school for practicing functional medicine, trying to get to the bottom of the why behind symptoms. So
That just seems so backwards. I just have to interject. That just seems insane to me because I think anybody's natural instinct, and maybe this is just me, who knows, is do what it takes. Like red tape be damned. Do what it takes to figure this out.
yeah, yeah. The big issue was the other funny component is they had a functional medicine master's degree, but inside their master's program, I mean, it was so textbook work and it was good stuff. All my colleagues, all my classmates were doing it, most of them anyways. But they didn't know how to transfer the book work into a clinical setting. Where the route I took was all about labs and clinical settings. So when I had these people coming in from the community, I could identify even during school what some of these why issues were going on. And for this particular woman, she had had every MRI scan, CT scan, blood work. I mean, any type of lab you could possibly have, she had it. And it all come back normal, which is a good thing. We don't want it to come back positive, but we think that we do. We don't want to get diagnosed with MS. We don't want to get diagnosed with Parkinson's or chronic fatigue syndrome or fibromyalgia or rheumatoid arthritis or whatever the disease is, even though that's what we've been taught to look for. We've been taught to search for a diagnosis because now we have something to call it, and then hence a treatment plan,
Right.
a management plan from it. So she was in such a bad situation that we actually had to find a black blanket to cover the window because the window was just bringing in too much light for her migraines. And she'd been like this for months on end.
Yeah.
So it's not like she's creating this stuff in her head. It's real. Like her physical symptoms were right there. I had the 25-page intake form in my hand, and yet all of these lab tests were normal. So for me, it was a light bulb moment where I said, if I want to have different results, I cannot look at her and her labs the same way everybody else does.
Right. Because that's
So
obviously not working. She hasn't gotten the help that she needs.
yeah,
Yeah.
no answers, no relief, just been told, go home and suck it up, I guess.
Yeah.
And so many women find themselves in these shoes. I mean, I don't know what your experience was like to even get a diagnosis of Hashimoto's, but it's pretty lengthy and extensive, and you have to fight tooth and nails.
I was actually really lucky compared to many women. It was probably from the onset of symptoms, which was during a pregnancy, and then ultimately that I lost that pregnancy to accelerating symptoms, probably about 8 to 9 months. So I was lucky compared to the years and years and years and years most people take to get a diagnosis.
Yeah. Yeah. And a lot of times, people specifically with a thyroid panel, they only get the TSH done. And I've had so many people say, well, my doctor won't take anything else. Well, that's just like getting a puzzle piece with only a few of the pieces. You can't complete the puzzle when you're missing so many pieces. And that's what's happening in blood work and taking labs, particularly with the thyroid.
Right. So the way, explain to me then what it is puzzle piece. Let's use thyroid as an example. So this is usually a diagnosis that takes years and years and years and years. My example, or me for an example, I had normal labs except for I had
The
antibodies.
antibodies.
Was my kind of out of range issue. So, but I wasn't getting the antibody test from my PCP. I was just getting, the normal thyroid labs, and it all kept coming back normal until, we had the antibodies. So, what is it that you dig for? How do you approach these kind of mystery cases that come to you?
Labs,
Yeah.
because numbers never lie. And I'll teach you how.
Yeah.
So, for example, let's use the TSH.
Okay.
The TSH is your standard thyroid lab marker, right?
And luckily for you, somebody at some point took the antibodies, which said, oh, well, we've got your immune system attacking your thyroid. That's what's
Yes.
going on. Now, the TSH normal lab range, give and take, depending on the lab, is between 0.5 and 5.5. That is the same as me telling you to find your favorite restaurant somewhere between California and New York. Good luck.
Right.
Whereas I can say, and I don't create these lab ranges, the researcher did.
Yeah.
It's all, functional medicine lab ranges. Where my TSH ideal range is between 1.8 and 3.
Mm-hmm.
So if you fall less than 1.8, we're looking at thyroid. If you fall above 3, we're looking at this thyroid cascade.
Mm-hmm.
Okay, so that's where we take the normal lab range, we condense it into the ideal lab range. And when you can do that for multiple markers on regular lab tests, like a CBC, a metabolic panel, the thyroid panel, the lipid panel, the urinalysis, like all of the labs that we already have in our possession, people have donated the blood for them, they've donated the copays, they've sat in the chairs and spent hours on and getting these labs. You just need the right person reading them, because your lab is only as good as whoever's interpreting it. And a lot of times you might have, well, my white blood cell count was high. And my doctor just said, okay, well, you have that high marker. Like they might not even address it.
Mm-hmm. Okay, well then what would a high white blood count indicate?
Infection.
Okay.
And let's talk about infections.
Let's do that. What is the connection with these chronic infections and kind of some of these other chronic issues that people I'm going to continue to probably reference women because I feel like we got the short end of the stick with some of these chronic issues that men do not. Endometriosis, PCOS, thyroid, chronic fatigue, all of this.
You'd be surprised though too. Over the last month, I've had to diagnose a handful of men with Hashimoto's.
Wow.
And that's pretty rare. But when I pull all of their labs, all their medical records, it's blazing right there. Antibodies. And then you can continue to find autoimmune patterns. And yeah, I just literally yesterday had to diagnose a 24-year-old with Hashimoto's.
Male.
And the sad part was I don't order these labs. I pull medical records. So somebody else already saw the lab marker and they just didn't even bother mentioning it to me.
That is really too bad. Before we kind of jump into what we were getting ready to just talk about, what is it, I guess, and I'm probably asking for more of an opinion-based answer here. What is happening? What is happening with this explosion of chronic disease, chronic illness, chronic issues that probably when you and I were kids and when our parents were kids, we were not seeing in the population?
Yeah, we're seeing it so there's these ICD-9 codes, ICD-10 codes, and soon to be ICD-11 codes. Those codes are for insurance reimbursement purposes.
Mm-hmm.
Those codes are diagnosis
Mm-hmm.
codes. And what we found is we were at ICD-9 for decades.
Yeah.
And that was sufficient. And then they created ICD-10. And the whole reason why behind that was there are more people with more compilations of symptoms that we have to create new names for because we don't have names before in the past.
That is a problem. That is a problem. And I think that's where my purpose behind doing this podcast and my purpose behind this whole thing is that to bring some sort of light to why is nobody asking why? Why is nobody getting to the bottom of this explosion of chronic disease in our population? The number's not going down.
No, it's going up.
The number is only accelerating. And what you just told me there with these insurance codes, it terrifies me. It terrifies me for my children. It terrifies me for my children's children. So again, is it environmental? Is it our food? Is it pharmaceuticals? Like what is your opinion here on this or your thoughts?
D, all of the above.
Yeah. Yeah.
Ultimately, I like to explain it like this. We all have cups and our cup is going to get filled with water and it's going to be different things that fill it.
Yeah.
Sometimes a baby is going to go through traumatic childbirth. That's going to fill up some of the cup. The immune system that the mother had, the bacteria, the gut component that the mother had, baby now gets all of that. Well, moms are, unless you're being very aware of it, our guts, our immune systems are already compromised. So now you're handing over a compromised immune system to your baby, which is going to raise the cup's water level. Now we're told, okay, we've got to inject vaccines. The moment that they're born, the water level's raised. They go back for their 2-month checkup, more vaccines, the water level's raised, until eventually they're 15 years old and trying to fight through lab or fight through high school and just get to the next class. When I've had so many moms reach out and say, my teenagers are falling asleep in class. What is the issue? And in all of the labs I've found, viral components, teenagers, women, adults, we are fighting these underlying infections all the time, creating a cascade of chronic complications that just continues to add to the water, add water into the cup. So eventually our cup is overflowing. And when that happens, your genes get switched on. Voila, you have MS. Voila, you have Parkinson's. Voila, you have PCOS, endometriosis, Hashimoto's, Sjogren's syndrome. I mean, you name it.
You name it. So where are these chronic infections coming from? Is it the breakdown of our bodies from pharmaceuticals from birth? Is it, I mean, how did we become so susceptible to these infections that are potentially just kind of creating this inflammatory response 24/7?
Well, when we think about infections, we have to think about specific ones.
Mm-hmm.
So ladies, when you're listening, go grab your labs. I'm going to tell you if an infection is the underlying issue of your health problems, right? So the CBC with differential is the standard lab test we all take. I pray your doctor has taken it. Sometimes they don't, and it really ticks me off because the CBC is the most valuable lab you could ever get if the right person is reading it. It needs to be a CBC with differential, and your doctor will know what that is. So if you're wondering, what lab should I take? I have XYZ and nobody can figure out what is wrong with me. Just go get a standard CBC with differential. Let your insurance pay for it.
Mm-hmm.
And then you'll know if you have an infection causing whatever it is inside of you. In fact, one of the ladies I got a call from her husband yesterday. I met with her 3 months ago, virtual, because I'm all virtual. She had frozen shoulder syndrome. Woke up one morning, she's 31 years old, has a baby and a toddler, can't move her right shoulder. That's an issue as a mom. And they're doing manual therapy, they're doing cortisone injections. I mean, they're just pounding the shoulder. You know what? Let's pull her medical records because numbers never lie. So I pulled her labs from her previous doctor, and the bacterial infection count was extremely high, one of the highest I've ever seen. And I said, all of the therapy getting put on your shoulder, it's not working because that's not the issue.
Mm-hmm.
You have a bacterial infection hanging out inside your body. It's just hanging out a lot inside your shoulder. 3 months later, yesterday, I got a call from her husband saying she's off all steroids. All of her joint pains are gone and her shoulder's just like it was before. Like you would have never known anything happened. But because the shoulder was the issue, everybody paid attention to the symptom. They didn't pay attention to any of the underlying stuff. And her doctor who took the labs said, oh, well, your marker's high for that, but it doesn't mean anything for your shoulder. So we just brush it off to the side. Whereas in my world, infections in that white blood cell count inside the CBC, they can deem anything. They can deem the onset of Hashimoto's.
Right.
Most commonly, viral infection, onset of Hashimoto's. Type 1 diabetes, a viral infection attacks the pancreas. Type 1 diabetes, so on and so forth. But ultimately, the white blood cell count is the very top marker of a CBC. What WBC. Chances are it's going to be normal. That's a good thing. But it might not be ideal. So if it's less than 5 or greater than 8, write this down so you can look at your labs later or right now. You have a low-grade hidden infection. That infection can cause infertility. That infection can cause fibromyalgia. That infection can cause the onset of autoimmune disease. That infection can cause endometriosis. I mean, the list goes on and on and on, because the infection's not going to just say, oh, well, if you have an infection, you have this. The infection's going to be the moment the cup overflows and your genes turn on. So whatever genes are inside your body, that's what you're going to see from a symptomatic standpoint. Does that make sense?
Yeah, yeah. So it's kind of the catalyst that kind of tips that cup and it cascades into all of these other issues.
Yeah.
So this infection, whether it's viral, bacterial, whatever, was just that one thing that was just too much.
Yeah. And a lot of times I'm thinking about your earlier question, where do we get these? How long do we, I mean, viruses are always in us.
Yeah.
We have bacterial and strains always in us. It's just a matter of, do we have too many bad guys and not enough good guys? For example, I was thinking about this last week. My little baby, who turns 1 this weekend, she came down with a fever. And we checked her ears, we checked her lungs, like we did all of our, crossed our T's and dotted our I's, and nothing came back positive. So here she has this fever. I have no idea why, until the fever broke, and a day later, her body broke out in a rash. My son, who's now 4, did the same thing at 1 year old, like my baby's just doing. So I knew immediately, as soon as I saw that rash, what it was: roseola.
Mm-hmm.
Roseola is a virus, right? So then I'm rocking her in the chair and I'm thinking, viruses, the most common cause of chronic fatigue.
Yeah.
That women fight forever. And here's my little baby already fighting a virus. What did I do about it? I gave her vitamin D, because I know vitamin D is powerful. But I mean, she's going to have this virus and many other viruses in her body at all times. It's just a matter of, when is it becoming more active versus dormant? And when it becomes more active, how active does it go? Is it so active that you literally can't walk up 5 stairs, or as many teenagers I'm seeing falling asleep in class? And then I look at their labs and I'm saying, well, their viral number is so high, it's so active, that if you were to go get an Epstein-Barr virus test done on them, mono test, it would actually come back positive. But that virus has to be so active to get a positive test. And then when you do get a positive test, what do they tell you? Go sleep for 3 months and good luck.
Right. You'll be fine.
Yeah. Your body will fight it off. Well, not if you don't give your body tools to fight it off. Then
Right. So why then and I guess this is a really good question for what's happening in the world today right now. Why then do some people have such a more difficult time with some of these viruses and others don't? What is it that we need? What tools do we need to be prepared to handle these viruses? Because like you said, we've lived with bacteria and viruses since the beginning of time. This is not new. What tools, and I think you mentioned one of them earlier, vitamin D, what do we need to be thinking about to be in the best shape possible so that these don't become chronic issues and this virus doesn't become kind of that catalyst that tips the cup, and that it doesn't become such a chronic issue?
Let's run away with vitamin D.
Okay.
And the whole immune system, right?
Mm-hmm.
Our immune system is our gut. We trash our guts. Our immune systems are trashed.
Yeah.
I mean, we're taught, hey, let's go get a vaccine because that's going to prevent sickness. When in reality, it could, but I would prefer, with my own body, I build up my natural defense systems.
Right.
So one of the ways to do that is vitamin D. And I just did a podcast episode on this, superpowers of vitamin D. So go check it out for all the details. But I want to share with you specifically, Brandy, you said you're in West Virginia, correct?
Yes.
Okay. So anybody who lives above the 35th parallel, which if you
I
were to
do.
look at a map, yes, you do. I do too. If you're looking at a map, it's going to draw a line straight through the middle half of California, underneath Nevada, underneath Utah, underneath Colorado, and just go all the way across until it's like right over Tennessee, over Georgia. Anybody in northern above that line does not, I repeat, does not make vitamin D at all for 4 or 5 months of the year.
Wow.
So that's November, December, January, February. So then when you get to March, which is what I've seen in the last month, these viruses are out of control.
Mm-hmm.
Epstein-Barr virus, like I said, I have seen it in so many teenagers that it's just become so active because the vitamin D hasn't been there.
Yeah.
And the vitamin D, it is the master key to your immune system. But here's a catch. A lot of people take vitamin D, but they don't take enough.
Mm-hmm.
2,000, 5,000 IUs per day. It's better than taking nothing, but it's not going to get your anxiety calmed. It's not going to help depression. It's not going to help your body fight off these infections and keep them dormant. It's just not. It's not enough. And the more research I've done on vitamin D, you have any type of autoimmune, vitamin D is the number one thing you should always be taking and never stop, because it's going to keep those flares down. The chronic fatigue commercials, we're told, hey, if you have chronic fatigue with your MS, you should go take this pill. I saw the commercial this past week. You don't need a pill. You just calm your immune system down. And you can do that with vitamin D. That's how powerful it is.
Wow.
But it's got to be the right dosage. So what I'm going to share with you and your listeners here is my vitamin D protocol. And I love this because it will basically take, I'm feeling like crap, nobody knows what's wrong with me, into, you know what, I'm starting to feel good. And it's just vitamin D. That's all I've been doing any differently. That's how powerful it is, because it's such a key player in our immune system. And when we're
right, because it functions in every cell, correct?
Yeah.
And we need it to function, like for our cells to function properly.
Yeah, there's a vitamin D receptor in every single cell in the body.
Mm-hmm.
Yeah. So like I said, a lot of people will take 2,000 to 5,000 IUs per day. And I'm about to tell you something very different. And some of you might think, oh, well, that's fine. And some of you might think, you're crazy. You're going to get me toxic. And I've had people, complete strangers, email me over this and say, you know what, you sound like you're really smart, but your vitamin D protocol that you're sharing with everybody, it's going to make people toxic. You should quit sharing it with them.
So what are you seeing then?
Because I am seeing in the labs, vitamin D is depleted. It's gone. It's non-existent. So from a lab standpoint, I've seen thousands and thousands of labs. I've seen less than 5 with good vitamin D statuses.
That's insane. That's a problem.
I've seen the 5 vitamin D statuses like that is because they've been following my vitamin D protocol the last 3 months, and then they went and got tested. And it's like, oh, well, your vitamin D is good now.
Yeah. Okay, so let's hear it. Let's hear the protocol, and then any recommendations you have as far as like length of it, and then also monitoring, because like you said, people might be a little afraid of something so high. How well monitored do you have to be while you're on this protocol?
So when it comes to the lab testing for vitamin D, the normal range is between 30 and 100.
Again, Texas or New York to California.
New York. Yeah. But this was more specific. Okay. So you're going to feel like crap if your vitamin D is in the 30s.
Mm-hmm.
Anxiety, depression, always getting sick, autoimmune flares. That's just going to be the story of your life.
Yeah.
But your vitamin D is still normal. You're going to feel a lot different if your vitamin D is around 80. So going from 30 to 80, that's when I get the email saying, hey, my anxiety is gone because I just followed your vitamin D. My MS, I'm out here in the sun in the summertime when it's heat, and usually heat is a problem. I don't feel it anymore.
Wow.
Vitamin D is that cool, that powerful. So the first month, this is a 3-month process. And if your vitamin D is in the 30s, 40s, or even 50s, it's completely fine to do this.
Mhm.
And if you're dealing with any of the symptoms, just do this anyways, because it's such a short period. You're not going to worry about toxicity. And even then, I still don't buy vitamin D has a toxic standpoint. I just don't buy it. 25,000 IUs of vitamin D per day for 1 month. So you're taking a 5,000 dosage and you're multiplying it by 5. 25,000 IUs of vitamin D per day for the first month.
Okay.
Second month, back down to 20,000. Month 3, 15,000. Month 4 and beyond, maintain at 10,000, especially if, like, even it's summertime, it's approaching summertime. If you work in an indoors, you need to take some vitamin D during the summer. Now, as far as kids and teenagers, that's the adult dosage. You'll want to manipulate that dosage. So say you got a child who 8 years old and their body frame is a lot smaller, you may want to do 15, 10, and 5. And then with a teenager who's 15 years old and fighting anxiety and depression, do 20, 15, and 10. So manipulate that as needed, but as the standard adult dosage, 25,000, 20,000, 15,000, and then maintain at 10,000, you'll feel a difference, I promise.
So that's kind of, like you said, people are seeing results in anxiety, depression, autoimmune flares, you name
Chronic
it,
fatigue.
chronic fatigue. So you mentioned something to me off air that shocked me a little bit because I had not had it in my notes and I hadn't planned on speaking about it. And that is that you mentioned to me that the most common,
Common cause.
the most
Chronic fatigue.
common
Yeah.
ailment that you see people for is chronic fatigue.
Yes.
That shocked me a little bit.
Yeah.
And it makes me a little sad too.
It plagues so many people.
Yeah.
And it's going from, you know what, I just don't feel like myself.
Mhm.
That's usually what people say is, I don't feel like myself. I don't have the energy I used to have.
Yeah.
I don't have, a lot of times moms will say, my kids, or I will fall asleep reading my books to my kids before my kids fall asleep. One mom, she was like, I finally was able to read books to my kids, and they fell asleep before I did. So for her, that was a huge win.
Yeah.
Chronic fatigue is the name of the game, and so many people just fight through it, survive rather than thrive. And I can almost guarantee that these infections are an underlying cause. So many people will say it's thyroid. So many people will say it's adrenals. And you get all the blood testing and take the ashwagandha and you take the Nature-Throid or whatever it is the doctor puts you on. And you just take it to take it, but it doesn't really, you don't feel anything. You don't feel any different. And the same thing is with hormones. A lot of people will blame their hormones and take progesterone to help them sleep at night, or they take metformin to help out with the PCOS. And the more we learn about all of these PCOS and endometriosis and hormone issues, it all comes back to infections and autoimmune. In fact, I believe in 5-10 years, endometriosis will be an autoimmune diagnosis.
Wow.
Just the more we learn about it.
So what are some of the most common infections that we're talking about here that people should look for?
The most common infection, especially with chronic fatigue, is viral. Now, we've talked about the white blood cell count. That is the top marker on the CBC with differential. Now, just look at your labs. You probably have it, whether you know what I'm talking about when I say a CBC or not, your doctor does. So if you don't have it, just go ask them. Go ask them for a CBC with differential. Because that white blood cell count will tell you if it's less than 5 or greater than 8, you're fighting an infection. And then you got to jump down. So skip several markers until you see this marker called neutrophils. Neutrophils is a marker that its job is to fight bacteria. So when your neutrophils are high, you're fighting a bacterial infection. If your neutrophils are low, it really doesn't matter. But the neutrophils, you want to see them around 60%. And make sure it's the percent, not the absolute value.
Mm-hmm.
I'll just keep it as simple as possible. 60%. If it's above 60%, you're fighting a bacterial infection. And that's typically something that we call like SIBO, small intestinal bacterial overgrowth, where you just have too many bad guys inside your gut and not enough good guys. And it's creating some gut issues like diarrhea, constipation, digestive issues, bloating, gas, things like that. That's what you're not going to have a bacterial infection become positive on a lab test unless you're complete diarrhea for a month. And then it's like, oh, E. coli, C. diff, Campylobacter, H. pylori, those things, just like a virus, will not come positive on a test unless it's extremely bad.
And that's unfortunate too, because then that sets you up for missing it all the time.
Yeah.
And it sets up for kind of this frustration of, well, I did this test and it all came back negative and I still feel like crap. I still can't poop, or I still can't stop pooping, or whatever, whatever it is. So this indicator, this very simple blood test indicator, points you in that direction.
Yeah. So the neutrophils are the bacterial component, and then there's a marker right below the neutrophils, and that one's called lymphocytes. Lymphocytes, that's your virus. They fight viruses. So when they're elevated, meaning over 30%, you have a viral infection. But remember, this isn't something that you're going to go get a positive test for. Yeah. I call this a low-grade hidden infection. That's just kind of out there, kind of a little bit active, but your body's still fighting it. So you're tired, you're depressed, you're anxious. I mean, you're anything really.
So these infections, these kind of active viral loads, can be anywhere, like hidden in thyroid tissue, hidden in. Why are they so difficult to locate, I guess is what I'm asking.
Yes, they can be in any tissue. It's just like locating heavy metals. I'm not a fan of heavy metal testing. Mm-hmm. They're not accurate. Heavy metals like to hang out in specific tissues because of content or fat content inside those tissues. It's not like you can, unless you're going to pull, an adrenal biopsy or a thyroid biopsy and actually look for heavy metals. I don't even know if you can do that underneath the microscope. But they're ultimately everywhere, especially parasites. Mm-hmm. A lot of people will think that they have parasites and who have gone third world country or whatever, and they get a stool sample and the stool sample comes back negative. Well, parasites are smart. They will hang out inside the cells of your body, inside the tissues. And it doesn't matter if it's just your gut or your stool. I mean, they're going to hang on anywhere they can hide.
Yeah.
And it's the same thing as the bacterial and the viral. Like we have our skin microbiome is another microbiome, just like our gut. Our reproductive tracts have microbiomes, just like our gut. Mm-hmm. We just think about infections inside our gut and inside our soul when really that's only a piece of the puzzle.
So it really doesn't matter where the viral load is.
No.
The treatment is going to be the same. And these blood markers are just going to indicate that this is the direction we need to be looking in.
Yes.
Okay. And this is why I feel like crap.
Yes. This is why nothing's working. I mean, I've seen people from the best functional medicine doctors in the world. Yeah. And they have their set protocol and they go through it multiple times. And if it doesn't work, it doesn't work. And if it does, it does. Mm-hmm. Whereas I can pull the numbers and I can say, you know what, your numbers tell me this specific to you.
Right.
And for example, I had a mom who just kept wanting me to throw supplements at her daughters. And I'm like, I won't do it.
Yeah.
I'm not just going to throw supplements at your teenagers. I don't care how sick they are. I'll give me their labs and I'll be able to tell you what exactly do they need. I'm going to save you time, save you money, and save you energy. Now, unfortunately, she didn't believe me for a couple months until it even escalated even worse. So now I get to meet with her tomorrow and I get to say, you know what? This is why I don't throw supplements at people. I would have never imagined that your 12-year-old is fighting an autoimmune disease.
Yeah.
I don't know what it is, but I can tell you that her immune system is so on edge that it's just going rampant.
Yeah.
It's just attacking anything. I could have never guessed that unless I saw your numbers. And now because I saw her numbers, I have an exact personalized treatment plan that she can now go out and perform and feel better in a month, 2 months, 3 months.
And see, this is what I think people don't understand at first, especially so me, for example, I didn't make my way to functional medicine until I was desperate. And many people, I think you can probably attest to this, many people probably do not make it to you until they're absolutely desperate because they haven't gotten answers anywhere else.
Correct.
So what we've been kind of conditioned to do in the Western medicine model, and again, I don't think Western medicine is or functional medicine is anti-Western medicine. It's complementary. But what we've been kind of conditioned is, okay, give me a diagnosis and give me something I can take to fix it.
Quick fixes.
A very quick fix. But what we forget is that we are all very biologically different, and kind of these blanket treatments aren't really working for the conditions that most of us are dealing with that are chronic conditions. Because what got me to my state of autoimmunity is probably not what got my next door neighbor to autoimmunity. It's very different, right? So this individualized medicine is extremely important, but it's not mainstream enough for people to accept it right away.
The problem is a lot of people will say finances. The number one question I get asked is, do you take insurance?
Yeah.
And I always reply, insurance doesn't take me because I get you out of the system.
Yeah.
And you have to, if you really want to be truly well and truly feel good, not just depend on a pill, you have to leave the insurance-based model. You just have to do it.
Yeah.
Which requires you pay for some things out of pocket. But I can guarantee you're actually going to make progress. I shouldn't say that because I've had many people who pay for thousands of dollars elsewhere and they don't make progress.
Yeah.
If you do it the right way, you will get progress and results. But you have to be able to say, you know what, I'm going to try something new. Functional medicine may be a brand new concept to you. But you're at a point where it's like, I just want to be myself again. And it's worth it.
And what's interesting is that, and I've kind of made this point on the show before, is that you have to think about your health in a very different way, more of a proactive way than a reactive way. And then you have to realize that if you approach your health in that way, then you're actually saving money on the back end because you've lived your life preventing these chronic issues that you don't have to be paying for when you're in your 80s and 90s and 70s or 50s. You know, it's getting younger and younger these days. But if you look at it that way, you're preventing these longer term issues.
I think a lot of us in our generation specifically, we've watched our grandparents suffer.
Yeah.
My grandpa had Parkinson's for 20 years. My grandma, who knew she had heart issues until they went in to perform heart surgery.
Yeah.
My other grandma, you know, her bones were so brittle that every time she moved, her vertebrae would fracture.
Mm.
And my aunts and uncles and family, they're like, Kylie, can you do something? Yes, but not anymore. I could have done something 30 years ago. But at this point, I can't save her bones. 30 years ago, we could have done some preventative things to prevent this from even happening.
Yeah.
So we have to think about that way. But then we also have to think about, I don't care about a diagnosis. My podcast is called Beyond the Diagnosis for a reason. I don't care if you have a diagnosis. I don't care if you don't. All the diagnosis tells me is that you have a set of symptoms that fall underneath an umbrella. That's all it tells me. It doesn't tell me how you got there, why your body started to attack your joints or whatever the case may be. But what I can tell you is that your labs, when they're read the right way, will tell me the why.
Yeah.
When I know the answer to the why, I don't care what your diagnosis is. I don't care if you have frozen shoulder. I'm treating the bacterial infection that I found in your labs. And you're going to watch that as your body is removing these burdens, it's just going to start thriving. And your fibromyalgia will become part of your history, not your present or your future.
Mm-hmm.
And that's such a foreign concept to so many individuals. I have Lyme disease. I have fibromyalgia. I have Hashimoto's. I have. I once did. I've now beat. It's a completely new concept that we're not taught. Especially now, you listen to the media and they're telling you to go get a vaccine because this virus is going to destroy your life. It probably has destroyed your life at some point already because of the reaction to it.
Correct. And I was actually going to get to this point, kind of talking about viral infections and viral infections being the catalyst to this explosion of autoimmunity. But if we know that viral infections can cascade you into immunity if your body is not in optimal shape, why then are we not talking about, hey, how can I get my body in optimal shape so that if I get a virus, it's not detrimental? I feel like we are missing this huge component to dealing with this virus, any virus, you know. I don't understand it. And it's really hard for me to wrap my mind around that this isn't a conversation that we're having. I mean, a lot of us are having it. We're having it on platforms that get censored or don't get put out there or can't be talked about in the mainstream. There are conversations being had, but that doesn't reach enough people. If you can save yourself some hardship and prepare yourself for if you get this virus, why wouldn't you do that? It's beyond me.
I think it all comes down to trust and fear. Do you trust your body enough, or are you going to trust somebody else's wisdom?
Mm-hmm.
And then you know as well as I know, fear-based marketing is genius.
Yeah.
That's what we've been taught the last entire year. And I mean, if you pay attention to any of your vaccine marketing, it is fear-based marketing. That's what it is. And so it's those of us who have to educate ourselves. And I promise there are more people out there like you and I. We just don't speak up because it is. I mean,
because their fear-based marketing is, hey, if you do, we're going to destroy you.
Well, we're the outcast too. And I mean, how many times do you see people posting on social media that, hey, I went and got my second vaccine today.
Right.
Nobody posts, I'm not getting the vaccine. I won't do it.
Hey, I'm taking loads and loads and loads of vitamin D. Well, and I think what's been really interesting for us and kind of how we've operated in our family this year, kind of on we operate on the more holistic functional side of things, is that gives you more empowerment over your health, therefore stamping out most fear when it comes to health related issues. And so this year has not been a fearful year for us. It's been a frustrating, as you know what, kind of year for us because we're not operating at that frequency that most of the population around us is. My kids are going to a school environment that's completely backwards to how we operate, which again makes you feel like you're living in the upside down. But it's not a foreign concept. It's actually ancient wisdom, right? Like when did we get away from like the ancient wisdom, common sense? This is what you need to do to be prepared for bugs.
Well, you're seeing a lot of, quote, the millennial generation, where somebody else thinks for people.
Yeah.
The media thinks for individuals. And we're stuck in the middle generation where we see our grandparents and then we see the millennials, and it's like we don't want either one of them. But ultimately, the conversation happens behind closed doors.
Yeah.
And more often than we think. We just don't go blast it on social media because it's not the popular thing to do. And we don't want to
No.
receive the backlash.
And I don't particularly, I'm actually a fairly private person. I don't really blast anything on social media anyway, other than, my podcast episodes and, some wisdom here and there. But I think, and I don't know about how you feel about our generation, but I grew up always questioning. We were taught to question everything. Don't take anything at face value. Question it. Does this make sense? And I felt like, for me, like I felt like this year, I felt like I was going crazy because I was questioning things like that were happening around us. I'm like, nothing makes sense. This doesn't make sense. So it made me feel a little nutty because that's just how I grew up. We question and, how does this fit? And I, in particular, like I love information. I love to read. I love to put the pieces together. I love, I've read studies this year. I like to dive into all of that. And I'm not a scientist, nor am I a doctor, but I do like information and I like to process information. And everything that I was reading, and everything that I was pulling from doctors who were willing to speak up is this big screaming from the top of their lungs, vitamin D, like we are depleted. We need this in our cells. You need to be prepared. Your body needs to be prepared for these kind of viral attacks that are coming at us. And what I was seeing happening was this kind of shutdown of shut up, don't talk about that. No. When I'm like, well, that makes sense, doesn't it? Like, why wouldn't you want to be in the best shape for in case you get this? So, yeah, this has been the most upside down, crazy year.
I will tell you and tell the listeners, I'm not one to take supplements. I don't recommend taking supplements forever. A lot of people will just take hordes and hordes and hordes of them to survive. And because that's the point where they're at, they haven't had any help from any direction, alternative or Western. And so now they're Googling and pulling whatever they can to just help themselves. But I will take vitamin D forever.
Yeah.
Vitamin D, the more I learn about it and the more I use it with my own patients and the more I preach it, the more it's life-changing and powerful on so many different levels. Like if you don't know where to begin, start taking vitamin D. It's the easiest place to begin, but take it at a dosage where you're going to see effects. And if you're worried about it, go get lab tested. Go ask your doctor and say, hey, can you check my vitamin D, please?
Yeah.
And be a little pushy about it if you need to be. And then you'll know there's a reason why I don't feel like crap. My vitamin D is at 38. I'm still normal.
But but not optimal, because like you said, there's a difference between normal and optimal, and you need your body to be functioning at optimal. And I think sometimes we forget how good we can feel because we felt like we've been running on empty for so long. You can get through the day, but that's not really thriving. And I remember when I first got sick and I thought to myself, I was 33 years old. And I remember thinking like, there is no way that I can go feeling like this for the rest of my life. There's just no way. And I'm sure up until that point, I'm sure there's a lot of signs that I missed. But when I started to feel good again, it was like, wow, I forgot how good I could feel. I forgot what having energy felt like. And people need to understand that. I took a lot of vitamin D and changed my diet. Sugar was a factor for me. Um, I removed some inflammatory foods, and then I started saying no to a lot of things. I was one of those people, I was a perfectionist, and I still am. I'm a recovering perfectionist, I guess I'll say. So I was putting a lot of intense pressure on myself. So there was a lot of outside factors. And then there was a lot of physical factors too. So yeah. But yeah, vitamin
Yeah,
D. Mine was 28, I think, when I tested initially.
yeah, that's pretty low.
Yeah,
I mean,
it
that's
was.
right below the normal line. But when I see 28, I'm like thinking, okay, 25,000, 20,000, 15,000,
Yeah.
10,000.
Yeah.
And not only one is it going to help you feel better, but two, it's going to help your immune system
Right.
calm down so it stops attacking your thyroid. And that's kind of how it works. One of the men I had diagnosed with Hashimoto's the last few days is that he is an MIT grad. He's 24 years old and already into his PhD.
So he's been
So he's
under
got a
immense
lot of
pressure for
pressure
for a
on
long
himself for a
time.
long time.
He's been living in a pressure cooker.
Yeah. Yeah, he's just smart and that's the way he took his life. And it's
Yeah.
like, has anybody ever talked to you about this number? No. Well, this is what it means. And this is what we're going to do to stop it from progressing and becoming worse so that you can not only have a functioning brain, but be able to stay awake while you're studying.
Right. So this, I mean, we've touched on so much today. I love to always ask my guests to kind of share one of their most proud kind of moments in being able to help somebody and turn their lives around. Do you have one that really sticks out to you that you'd like to share?
The best ones for me are usually the ones with infertility because it's such, you know exactly when you were successful. You got a pregnancy, positive pregnancy test. But more importantly, when they actually get through the pregnancy, you and I have both lost one. We know that getting pregnant is only a piece of the puzzle. It's only the starting part. You got to get through the rest of the pregnancy and then have a healthy baby and healthy mommy. So those are always the best phone calls though when you get the call that they're pregnant. Especially when they've been told, you know, I've got PCOS, I have endometriosis, I'm never going to get pregnant unless I try $20,000 IVF fertility treatment. But then the other ones are just the simple wins people have. The phone call yesterday, hey, my wife is no longer in pain. Thank you so much. The mom telling me that she gets to read books with her kids at night. Like just those simple, small moments that people that do have their health take for granted.
Exactly. And again, I think it just points to the fact that we forget just how important our health is and that we're not starting with that foundation from day one. It's not something that I think we get a whole lot of education on. And I also think that we've reached a point where we're not giving people options on how to manage their health. It's kind of like, this is the way, this is the standard model, this is what you go through. We take your symptom, match it with the pharmaceutical, and off you go. And I think that it's extremely important that people understand that they have complementary medicine and they have other options. And it's empowering. It's empowering that way. So I appreciate what you do very much.
Yeah, there's people like you and I who have podcasts who try to teach people, hey, this for me, this is what your labs say. Now you know. Now you can, the power is back in your hands.
Right.
You're not being dependent upon the copays and the doctor's visits and even the functional medicine practitioner.
Correct. I had one of the best practitioners I ever saw told me, I don't really want to see you back in here. I want to get you to a point where you have your health in your own hands. You know your body well enough to know what you need to do, that you only call me in case you can't get it under control. And that's it. And that was like, whoa, that is awesome. That is the model I can get behind.
Yes.
So Dr. Kylie Burton, this has been an awesome conversation and I'm so grateful for your time. So thank you so much for coming on.
Thanks for having me, Brandy.